All right, wonderful. Well, thanks again for joining me. My name is Dr. David Kunashko. I'm the medical director here at BIOFLEX Laser Therapy, and we manufacture and support different types of what are referred to as photobiomodulation devices, both for healthcare professionals and for consumers at home. And today's webinar is focused on hip pain using our consumer level device at home. So I'd like to preface today's webinar by saying that all my webinars are recorded, and within a week or two, they're uploaded to our website under support. And if you register for the webinar, even if you can't join in or need to leave early, you'll still get a follow-up email with a link to watch it again whenever you want. I love questions, so ask me all the questions that you want in the Q&A box, not in the chat box, and I will get to those questions at the very end. Okay, so typically I'm going to, with these webinars, I'll do just a little brief summary on what our systems are about and a little bit about photobiomodulation as a review. And then I'll go right into the common causes of hip pain that you may be suffering from, or a family member or what have you. And then specifically how you're going to use this device to help with that, manage the symptoms, especially the pain as well. And then of course, I'll take time to answer your questions. So our devices, you know, they look something like this. These are, I'm just trying to adjust my image here at the bottom. Just give me a second here, there we go. We have two types of home devices right now. Now, these are meant as therapeutic devices. They're medical devices. They're designed to treat specific conditions. I should mention that very soon, within about a month, we're going to be releasing a whole new series of light devices for wellness, not necessarily for treating your hip pain, you know, a bursitis or arthritis specifically, but more devices used for overall wellness, everything from helping with your generalized well-being and metabolism and sleep patterns and so forth. So if you're interested in learning more about that, and we're having a release of many of these devices on July the 8th at our masterclass. So if you want to watch it live and learn more about those devices when we release them, and a chance to win some free devices as well, I would encourage you to sign up for a masterclass. Right now, there's a good early bird special on it. You can just go to our website and find that. Now, these personal devices come in different sizes: of P120, 120 diodes, 180 diodes, with obviously a controller system as well. And on the front-facing portion of the device are bicolor superluminous diodes. These are not lasers; they are high-powered bicolor superluminous diodes. They're focused LED light to allow the light to be quite strong, but obviously they're not a laser. Powerful lasers are restricted in the medical field, which is why one shouldn't be using them, you know, unless you're in a setting where you can, you know, have all the safety features controlled. But these emit two wavelengths, red and near infrared, that are critical for helping the body recover. Red light, as you may or may not know, is one of the key wavelengths used in photobiomodulation, but not the only one, although that's the one that seems to always pop up on social media and everything. Red light is a really good wavelength, but does not penetrate very deeply. And so we also use near infrared. It does go much deeper, levels of, you know, several centimeters into the body. And using the two combined, we'll be able to cover and treat large areas of tissues, as well as large volume of blood. Now, our controller unit has a series of protocols and the protocols have been developed over the years, 33 years to be exact, here at BIOFLEX Laser Therapy. And today, obviously, we're focusing more on using the HIP protocol. So I'm going to talk a little bit more about that specific HIP protocol. The other thing that you should be all aware of if you're using this device is it has 4 treatment stages or levels. They're synonymous. Now, some people don't really quite understand, and I do have webinars on this, so I encourage you, if you're not quite sure, to revisit those webinars where I talk a little bit more in depth about these stages or levels. And the first stage or the first level is the one that we always recommend. Please don't think that the higher the stage, the better the result. It's not necessarily the case. The lowest level, especially for red light, provides the most amount of energy for red. And the reason why that's important is that has the most anti-inflammatory effect. So for inflammation and for initially when you start treatment, it is recommended that you start with this lower level 1. And I'm going to talk a little bit about when you might want to change these levels as well. By the way, if I just skip back to that slide, these protocols are based on our professional equipment that have been in use for 3 decades. So the actual dosaging is exactly the same as our professional systems, but just packaged differently with the array that is associated with this particular system. So we know that the protocols are quite effective. So photobiomodulation works in many different ways. One of the main ways that you probably heard about how it works on the body is it interacts with mitochondria. And I'm sure you're aware, mitochondria are the powerhouses of cells. They control the metabolism and the ability of cells to repair and regenerate. So if you have a torn muscle strain, right, or a ligament sprain or bursitis or any other form of injury or even disease process like osteoarthritis or what have you, the cells under inflammatory stress. And this inflammation reduces the capacity of cells and tissues to repair themselves. And thus, when there's constant inflammation, the tissues continue to deteriorate and they start to lose their ability to function. And of course, then you start to get not just pain, but other symptoms like decreased strength and motion and other issues, right? And so what photobiomodulation does is it actually interacts with mitochondria and helps to restore metabolism to these cells and tissues. Now, of course, it's not doing it 100%, and it's not a panacea, but it can certainly help with improving the functioning of cells and tissues that are under inflammatory metabolic stress, and therefore your ability to recover is faster. And so essentially that's how it works. There are 2 types of effects of photobiomodulation. One is directly on cells and tissues that are injured. So in this case, I'm showing a nerve cell, but it can be any cell. The mitochondria are impaired. That's what these red little ovals are. And then when exposed to the correct dosaging and wavelengths and parameters of photobiomodulation over time, these mitochondria start to become more normal, and therefore metabolism starts to increase, and now the cells start to function optimally. And so that's really the goal, direct irradiation and absorption. The problem is that light does not penetrate very well into the body. So even though you might have lots of dosage on the surface of the skin, the ability of that light to penetrate deeper is markedly reduced, is exponentially reduced as you go deeper and deeper. So some tissues, especially like the hip, it's really challenging to get a lot of light deep into the area that you're treating. So what you want to do is invoke a systemic or remote effect that works on the blood and even bone marrow. And it actually stimulates circulating white blood cells or immune cells that control inflammation, as well as stem cells and platelets. And of course, these are circulated in your blood, and they will supply deeper tissues and deeper areas where the light cannot effectively reach. So you always need, or you should, be doing a direct type of photobiomodulation and a systemic or remote effect to get the optimal treatment you can out of photobiomodulation. And that's really how our systems are designed. So let's get into hip. Now, 1 in 4 adults will develop symptomatic hip osteoarthritis. And this is from a fairly recent journal article published in the American Family Physician called Hip Pain in Adults. And by the way, that reference is what I'm using a lot for this next bit of information, if you're curious. So in adults older than 45, I may be over 45. I have to double check my birthday. 6.7 to 9.7% have osteoarthritis of the hip. And 1 in 4 will develop, as I mentioned, symptomatic hip osteoarthritis in their lifetime. So 25+%, you're more than likely going to have, and it's probably higher than that, to be honest, you're going to have some hip issues with osteoarthritis. And if you're a Labrador Retriever watching and listening in, I'm pretty sure that those numbers are considerably higher for purebred labs. Just a little aside. So in the United States, because all stats come from the United States, in 2009, hip replacements accounted for $13.7 billion. So you can imagine it's 2023. I bet you that number is 20, 30, $40 billion now. Divide that by 10, you get Canada. Hip pain is often localized to 3 regions of the hip: anterior, which is the front; lateral, which is the side; and posterior, which is your derriere or behind. So this is essentially what I'm referring to. In anterior hip pain, and we're going to talk about that, this is sort of in your groin area. And this is probably the most common location for hip pain. Then we have lateral. So if you feel the side of your hip and you feel that bone, that's a greater trochanter in and around that area, lateral hip pain. And of course, in your buttock, from the top all the way down to the gluteal fold and towards your sacrum, all that region is considered your posterior hip. So these are the areas that we're going to focus on today. Now, let's start with anterior hip pain. Typically, anterior hip pain is coming from the hip joint itself. So usually when you have anterior hip pain, it is a joint problem. Not always, but almost, majority of the time, that's what you're dealing with. But other issues like hip flexor strain, for example, the psoas major, which is your main hip flexor, and the rectus femoris of your quads, these can be strained as well and have tears. Or you can have avulsion fractures. Usually that's due to trauma. These can all be associated with anterior hip pain, but usually you kind of know that because you've done something and you go, ow, I hurt my hip. Now, other sources of anterior hip pain are not from the hip. Intra-abdominal problems. For example, appendicitis can refer pain in that region, a hernia as well, bladder or the female reproductive system like ovarian cysts. These can all cause pain in that anterior groin region, and you go, oh, my hip is bothering me, and it's going to, treat my hip. I always say to that, if you have pain and you're not sure what's causing it, I'm not talking about Dr. Google. I'm talking about you went to a physician or healthcare professional, get it checked out, because it may be something more serious, or maybe it's not even the hip, for example. Okay, so make sure that you get a proper diagnosis before you start treating yourself. Let's talk about some of the causes of anterior hip pain inside the joint. Something called femoral acetabular impingement. You can see a couple little pictures here. I don't know if I'm gonna point. This is new to me here, right? Can I even do that? No, this is impossible to do that. Hang on. No, I have to think in reverse. Do you see it there? That little bump? There we go. Look how big my hand is. So anyway, sometimes you can have an overgrowth of bony portions of the hip, and this causes impingement as it tries to move in the ball and socket joint. There can also be a pincer deformity of the acetabulum, which is the bony portion of the socket as well. These tend to be gradual onset without necessarily a known injury, and usually they're diagnosed with an X-ray or an MRI. So something like this, you wouldn't necessarily know. You would need imaging to actually find out if that's the problem. And it's going to cause pain and inflammation because you can imagine it's rubbing. Oftentimes you need surgery for this, but sometimes it can be managed without surgery if it's not too severe. Another common cause of anterior hip pain in the joint are labral tears. Now, a labrum is a cartilaginous rim that deepens the socket of the hip joint to allow that ball to sort of stick into it a little bit better. And labral tears oftentimes are caused by trauma, like traumatic injury, but they can be caused by repetitive movement. So if you have a job or you do a sport or whatever that has certain kinds of movements, you might tear your labrum. This is a nasty, nasty problem. Cartilage doesn't have a direct blood supply, heals very slowly, if not at all. And if it's a large tear, you're probably going to need surgery. Some of the symptoms you look out for are popping or catching or clicking with specific movements in the hip. This is where a good orthopedic examination usually will determine what's going on, and it can be verified. For this, you would need an MRI. An X-ray is not going to show a labral tear. You can also get femoral neck stress fractures. These are more common in females, especially with weakening of the bones due to osteoporosis. So it's another potential issue of pain in and around the hip that typically needs to be diagnosed with specific diagnostic imaging in order to see what's going on in the bone itself. Then there's something called a very serious condition called avascular necrosis, which is where the blood vessels that supply the femoral head, they actually become interrupted. There's a whole bunch of list of metabolic and other disorders that can cause this. And it seems to be more associated with the elderly or middle-aged people. And, you can imagine that as you start to lose blood supply to bone, it deteriorates and then causes a whole array of issues. If it's picked up early enough, there's some things that can be done, but oftentimes it requires full-on hip replacement. So one needs to be aware of that. By far, the most common issue in the hip, as you can imagine, is osteoarthritis. So usually there's a common gradual onset of pain, usually with prolonged sitting or walking for long periods, and you may have a bit of a limp when you're walking as well. One of the common signs of this is where you're sitting and watching a show or whatever, and then you get up and immediately you have some pain in that hip. So definitely get that checked out, and imaging x-rays are a good way to start to see what's going on there. Now, let's move on to lateral hip pain. As I mentioned earlier, lateral pain is on the outside of your hip. Some of the causes include greater trochanteric bursitis. Usually that's associated with a muscle on the side called the gluteus medius. And oftentimes there's a tendinopathy or a tendonitis or tendinosis, and or tearing of the tendon is one of the more common causes. Again, tend to see this more in females. And the reason why this crops up a lot in females is that the angulation of the bones at the hip lead to more stress in the hip joints. For childbearing purposes, that's the way the anatomy was designed. So unfortunately, not only do you have to give birth, you have to deal with a greater onset of hip pain as well. Of course, you have other advantages that I won't get into. So that is one of the more common causes of lateral hip pain. Posterior hip pain, this is pain behind the gluteal region. One of the more common causes that we come across and that you're familiar with may be deep gluteal pain. So you feel it right in your buttock, but it feels really deep. Usually this is caused by the piriformis muscle. It can also compress the sciatic nerve or just be in spasm or really tight. Sometimes that's called piriformis muscle syndrome. It can also be entrapment of the sciatic nerve. There's also other deep muscles in the hip that can cause deep buttock pain as well. So usually if you have an adept manual therapist, and that's the problem, if they combine light therapy with manual therapy, you'll tend to get really good results with these kinds of problems. Other things that can cause pain in that region include the sacroiliac joint and the lumbar spine. So it's important to understand that if you have pain back there, it may not be your hip. It may actually be your lower back or the sacroiliac joint. They can refer pain or cause pain in that general area. So be sure to have that area examined as well, because, you may be treating the hip and it's not the hip, it's the SI joint or even the lumbar spine. And lastly, hamstring muscles, where they originate on the ischium, which is that sort of bone that you feel when you sit down in the lower portion of your buttocks. And so usually, you know, if you have a hamstring pull or a strain, you know, you usually know what you've done. But these can they can take a while to heal. If it's a tendon, that can take even longer, but they can definitely refer pain in and around that lower portion of the posterior hip region. Okay, so what is BIOFLEX laser therapy doing? Well, I talked about the benefits of photobiomodulation, but these also ultimately help improve circulation. They help to restore collagen formation and repair of damaged tissues. They help to repair and restore function to muscles that are injured. They help to reduce inflammation and edema caused by injury. And if there's any other issues with the bone or cartilage or nerves, they can also help have those tissues repair faster as well. So our system, the home system, as I mentioned earlier, has 4 levels, and we're going to be using the HIP protocol. Now, this HIP protocol is the longest in time out of all the protocols. And the reason for that is that the hip joint is so large and so deep that you need more time and hence more energy and dosage to make its way down into the hip joint and to treat the large volume of blood. So the red light's on for about 6 or so minutes, and then that switches off, and then that turns into near infrared for another 12 minutes or so. So you're looking at about 18 minutes of treatment time just to treat one area. It sounds like a long time, but the hip is very challenging to treat, and it does need to be treated a little bit longer than, say, your elbow or your shoulder. So again, the levels that you use, 1 through 4. Now, 4 has the lowest dosage and the lowest number of pulses of light, whereas the level 4 has the highest. The only exception there is I mentioned red light. Red light has the highest power in level 1, and then it goes to about 90%, 80% in the higher levels. And the higher levels are providing more energy with near infrared and more dosaging. The red is very helpful for reducing inflammation. So if you have an acute inflammatory issue, the level 1 is by far the most effective treatment sort of stage or level that I recommend. When you first start to treat, I'm going to suggest you treat once a day and treat about a week or so. Treat most days of the week. And once you're starting to get to 4, 5, 6, 7, 8 sessions, then you can see how you're feeling. If you're feeling like there's not a lot of changes, not a lot of stuff going on, not a lot of improvement, then you can up it to the next level up. So if you feel your symptoms are improving, then you can continue to use that specific level that's showing good benefits. So again, the HIP protocol level 1 uses continuous red light for about 6 minutes. There's no pulsing of the red light at all. And this is the level that provides the maximal anti-inflammatory effects on the circulating white blood cells, stem cells, and platelets. So it's an important level in order to maximally decrease inflammation in the area. So how many placements should you be using, right? So in general, the number of placements reflects the area being treated. The larger the area, the greater the number of placements. I'm going to walk you through treating all these conditions I just talked about. So the arrays come in different sizes. The previous picture showed you the 120. This is the P180. Remember, it's always important to get an accurate diagnosis. If you're not sure what's going on, see a doctor, see your healthcare professional, whether it's a chiropractor, a physiotherapist, or a massage therapist, someone that is well trained. Then they can help give you guidance. Maybe they say, hey, look, you know what? Maybe you need some imaging. Go see your family doctor, or if they're a chiro, they can do it at their office or what have you. That's really important because that will guide you how to treat at home and what else to do, like exercises or other types of treatment to get yourself better. When you're treating anterior hip pain, I showed you a little diagram here. It's called like a figure 4 position. this opens up the hip joint and allows light to penetrate the deepest into the hip joint. Now, I have to preface this by saying it can be uncomfortable to completely open up the joint like this. So even though I'm asking you to position your joint and open it up, do so very gently. And if it's bothering you, start closing it up again. Okay. But once you get into a position that you're comfortable with and you can kind of open it up, put some pillows, prop yourself up, do it in a way that you can safely be in that position for, 30, 40 minutes or so. Okay. So that's important. If you have it in a closed pack position, you can still treat the area. It's just that it won't be as effective. Okay. So if possible, I prefer this open pack position. I see a few questions. I would definitely get to these questions at the end of today's webinar. So I'm going to suggest that you place the treatment array in two positions. You can see here on my diagram here, where I've positioned it over the upper and lower anterior portion of the hip joint. So in this case, the total treatment time is about 36 minutes if you're using just, one session than the other session. After the first session, it may feel pretty warm. And that's because of the electrical current, not so much the LEDs. If that's the case, just let it cool down for a few minutes and then do the second session. A little bit of heat's okay. In fact, I do recommend using a warm, moist compress after the light therapy treatment with chronic conditions like arthritis, because it helps promote the systemic effects of the light. But if it's an acute injury or an acute problem where there's already inflammation, I'm not going to recommend using heat, obviously. Now, for lateral hip pain, it's funny, I'm using this different format where you see me, instead of up in the top of the screen, you see me like this. It doesn't allow me to format my animation. So I forgot about that. So I apologize for this kind of mess up here, but for treating the lateral pain, I'm going to suggest you lie on your opposite side. And remember, your skin has to be exposed. For all of these sessions, you have to put it on your bare skin. Now, you can slip it under your shorts or your pants or your undergarment, whatever it is. That's fine. But what you don't want to do is put it over any clothing because the light won't penetrate very well. So usually one placement for lateral hip pain is adequate. You can't see it here, so I'm going to kind of draw it out here. If you follow my line and cursor, this one position here is usually okay. But for larger hips, or if you want to be a little bit more aggressive with the treatment, you can do two treatments and sort of wrap them around the greater trochanter, which is that bump on the side of your hip. Put one just above and one just below to cover that greater trochanter area, and do these two placements. So the choice is yours, minimally one, but sometimes you can also do two as well. Oh, you guys say you can't see the cursor. Okay, let me see if I can point. No, I forget it. But anyway, I hope you can see that there's an array underneath the two vertical ones, and that's the one solo placement. I didn't realize you can't follow me that way either. I'm gonna have to figure that out. I don't know if I can change that in the settings. Hope that's obvious. So, okay, next is treating posterior hip pain. Now, treating the deep gluteal musculature is challenging because these muscles lie deep to many layers of thick muscles and sometimes a bit of fat there, right? You do have to be patient here. You're not going to get a lot of light really super deep, but you can help with the systemic circulation as well. I usually recommend here you're just lying on your stomach with some pillows. That's usually a good location. I don't usually recommend that you sit on the device because it will warm up prematurely, and it's probably just not the best way to do it. So if you can comfortably lie on your stomach with some pillows, that's probably the best position to be in. The placements on the far right represent where you should place the array for deep gluteal issues. And if you shift them over towards the midline, that's for the sacroiliac joint. So unfortunately, I'm not able to show the animation, but I think you can kind of see for the gluteal, deep gluteal muscles, place it literally over the middle of your buttock. On the upper portion and the lower portion, usually 2 placements is adequate. And then to treat the sacroiliac joint, you would shift them over where the sacrum meets your ilium, and that's the sacroiliac joint. Now, if you have hip pain coming from your lower back, this is where you're going to shift things. If you're finding your hips okay and it's actually referred from the lower back, I'm going to suggest you use the lower back or the lumbar spine protocol. And for that, you're going to choose that protocol and do at least 2 placements over the lower back. One just at where the spine meets the sacrum, and then just one a little bit lower to cover what's called the lumbosacral region. And you can shift them towards the affected side. So if it's right-sided, shift them a little bit more to the right. Remember, it's important to have an accurate diagnosis to know what it is you're treating. So you can imagine you're treating your hip, you're treating your hip, you're treating your hip, it's not getting better. And you go, well, this is not working. And it's like, well, guess what? That wasn't the problem, right? So again, just, please see a healthcare professional to figure out what's going on. Now, for hamstring issues, someone mentioned that question earlier. I'm going to suggest you use the hip protocol. And the reason for that is hamstrings are thick, deep muscles. So the hamstring protocol, or the protocol for the hamstrings would be reflective of treating deep gluteal musculature. So I'm going to suggest you use the hip protocol as well. And I'm going to suggest you use 2 placements, one just at above the gluteal fold and one just below the gluteal fold to treat the hamstring tendon and musculature for lower posterior hip pain. So in summary, most hip pain is chronic, and the symptoms take a while to manifest, and therefore they take a while to get better. So be patient. Usually you require a longer treatment plan. You need to combine active therapies and exercise and stretching, maybe some other treatment in order to really make some good progress. Always start at level 1 before going to level 2. You may require some x-rays or imaging to really figure out what's going on. If your symptoms are not showing signs of improvement after about a month or so, I'm going to suggest you get it further reassessed, because maybe there's something else going on, or maybe it's more severe than what you thought. If their symptoms are acute, I'm going to suggest you treat daily for about at least a week or so. Then you can go every day, maybe 4 or 5 times a week kind of scenario. If your hip is due to chronic progressive issues like osteoarthritis, you're going to need ongoing therapy. Once you get it under control, then you may still need to treat it once, twice, 3 times a week, just to maintain the effects of photobiomodulation and even slow the progression down of osteoarthritis. Labral tears are really challenging. I've treated quite a few. For the most part, these patients were helped, but it was challenging. And the amount that they were helped varied, some significantly and some minimally. So it all depends on the type of the tear, which you can only be diagnosed with proper imaging. Smaller tears can take many months to heal as well. So just be patient. Wonderful. Thanks for joining today. Next webinar is a professional series. I'm doing one on Thursday, June 22nd for plantar fasciitis. If you want to care to join me for that one. And I mentioned our masterclass. It's up on our website. It's a live in-person event, and we're live streaming it as well. So your choice as to how you want to attend. But we'd love to see everyone out there, especially for the release of our new line of devices, which should be really exciting, because we've been putting a lot of work and effort into these, again, based on the research and our protocols. So they're going to be quite unique compared to what other devices are out there, as far as LED panels or wearable technology, that kind of thing. So, and the price points, depending on what it is, are pretty good, I think, too. So certainly competitive. Again, thanks for joining me today. My email is david@bioflexlaser.com. Question from Joan: recently been diagnosed with calcium crystals in the joints, also osteoarthritis, what would be the protocol for the diagnosis or for this diagnosis? Yeah, so crystals in the joints, there's going to be a certain amount of inflammation. So I would just use the protocol specifically designed for that area where the crystals are. There's not going to be one specific for that, but it's just going to help with inflammation. But usually the lower level protocols will be more helpful with crystal deposits in the inflammation. Helen asked a question, could a small fall last September that caused some right hip pain have kicked into osteoarthritis? Yeah, it's interesting, right? Because sometimes we have an injury and then it never really goes away or it kind of triggers something. Osteoarthritis, generally speaking, you need 40% of damage in the joint before you become symptomatic. So you can have an x-ray of a joint and the doctor can say, well, you have some arthritis there. And you go, I don't know what you're talking about. I feel fine. It may not be symptomatic yet, but it's on its way. So you may have had some underlying osteoarthritis there already, and the damage to the joint, the injury may have, in fact, damaged the joint a little bit more and led to more progression of the OA. So as far as the labral tear, I think I covered that. I'm going to still use for the personal system the hip protocol. But this is where opening up the hip joint, that figure 4 position is really important. And you can even put some pressure with your hand on the array into the tissue to allow that light to go a little bit deeper as well. How long should I treat the labral tear for? What's the typical healing time frame? I think I covered that. It depends on the type of tear. I don't know the type of tear, Ron. So, and that's only told with imaging. A small tear, it can be months. I've seen them last a year or 2 years. And I've seen some that have never really completely resolved, but those are usually more significant tears. The online for the masterclass is 149, is also 149. I don't know. To be honest, I didn't check, so I'm not sure if it's the same price or not. Maybe it's a little cheaper, but let me look into that and I'll ask the higher powers. Siba said that yes, it is 149 as well too, so it is the same price. But you have unlimited access to the class. If you're in person, you don't. So there's a bonus right there. And maybe we'll throw in something special for the online folks as well that the in-person people won't have. But if you have a chance, 149 Canadian, what's that, like $50 US or something? I think it's worth it. It's worth it. I'm going to be lecturing on ligament sprains. Dr. Randy Santiago will be talking about how to treat concussions. Dr. Ben Ewan will be talking about treating rotator cuff tendinopathies and ACL at the knee. Slava Kim will be talking about some other sporting injuries, and David Barker will be talking about wrist fracture and post-ACL surgery recovery as well. It should be really a fun day, but I'm especially looking forward to the release of these new devices too, which I think a lot of you, especially those listening today, can use it in combination with what you're using already with our system to get really good overall wellness effects. I think that's about it. Oh, there's some questions in the chat box, which is okay, I guess. I have deterioration in L3, 4, and 5. Can you use your equipment to help this? Well, ameliorate. Okay, first of all, it's not going to get rid of deterioration. What photobiomodulation has been shown to do is, number one, help with the inflammation, but also slow the progression down. So there's been several studies, Stephen, that have shown that when you use photobiomodulation therapy, it reduces the percentage of people that need knee joint replacements, for example, and it can help repair hyaline cartilage. But what it's not going to do is get rid of deterioration. It just won't do that. But it can certainly help along with other things, right? Exercise and nutrition and so forth. All right, thanks everyone for joining in. I really do appreciate that. I look forward to seeing you all maybe at the next webinar. And I'd love to see many of you out, if possible, at the masterclass, either online or in person. In person, you get a great meal as well. So that's also a bonus. And also you get to try out all the new equipment too, which is cool. All right. Thanks everyone. Take care. Have a great day. Bye now.